Good afternoon. It's a great privilege to be speaking before this academic community. I'm Dr. Sahan Viduranga, a registrar in dermatology. Today I am here to present our research title on body region predilection in leprosy, a descriptive study at a children's hospital and central leprosy clinic in Sri Lanka. As you all know, leprosy is a chronic infectious disease affecting the skin and peripheral nerves. Although some body regions are thought to be more commonly affected, detailed data on the frequency and pattern of regional involvement are limited. The main objective was to determine the frequency of leprosy skin lesions in different body sites among children and adults attending to specialized clinics in Sri Lanka. We have conducted a descriptive cross-sectional study using retrospective analysis of clinic records at the Central Leprosy Clinic NHSL at Dermatology Clinic, Lady Ridgeway Hospital. We have included all children with leprosy attending the Dermatology Clinic LRH from 2017 to 2024 and all adults with leprosy attending the Central Leprosy Clinic NHSL from 2020 to 2023. We have excluded patients with leprosy whose records were incomplete. Altogether, our sample size included 114 children and 211 adults. We used consecutive sampling method and data were extracted from patients' clinic records using a pre-designed data collection sheet which includes socio-demographic details and disease-related details. The chi-square test was used to assess statistical significance and a p-value of less than 0.05 was considered statistically significant. In children, the mean age was around 9.4 years. In adults, it was around 40 years. In children, both boys and girls were affected almost equally. In adults, males were affected more than female, and this difference was statistically significant with the p-value of 0.002. In children, around 90% of children had single lesion leprosy, but in adults, around 50% of patients had single lesion leprosy. This diagram shows the distribution of lesions in children. As you can see, the most commonly affected body site were the upper limbs, followed by face and lower limbs in children. When we consider adults with single skin leprosy, the most commonly affected sites were the elbow, followed by forearms and legs. Adults with 2 to 5 skin lesions, again the most commonly affected site was the elbow, followed by forearm and face. In adults with 6 or more than skin lesions, the most commonly affected sites were elbows as well as the posterior trunk. When we consider the entire adult sample, the most frequently affected body site were the elbow. Around 54% of patients had at least a single elbow lesion, followed by forearms, face and arms. So this diagram shows the comparison between the children and adults. You can appreciate that in both age groups, the upper limbs were the most commonly affected sites. In adults, there was a predilection for elbow. This bar diagram shows distribution of leprosy lesions in different anatomical regions in both children and adults, with upper limbs affected more frequently, followed by lower limb. The upper limb involvement in adults was significant compared to children. The p-value was less than 0.01. Here you can appreciate that the elbow lesions are more common in adults compared to children, but in children, the involvement of arm, forearm and elbow almost equally affected. Here you can see in adults, the elbow involvement was more common than children. The p-value was less than 0.001. In lower limbs, again, in adults, lower limb involvement was more common compared to children. The p-value was 0.035, which was statistically significant. This bar diagram shows involvement of different anatomical regions of the lower limbs, where the leg has been affected in both adult and children, followed by the thigh. When we consider the involvement of the foot, in adults, the involvement of the foot was more common compared to children. The p-value was 0.002. When we come to the elbow versus knee involvement, in both adults and children, the elbow involvement was more common than the knee involvement with statistical significance. In conclusion, among adults, men were affected more frequently than women, and the elbow was a notable site of predilection for leprosy in adults. In adults, the involvement of the elbow as well as foot was significantly higher compared to children. The skin lesions were predominantly symmetrical in both adults and children. The elbow involvement was more common than knee involvement in both age groups. So we believe that these findings can be used to create a visual map highlighting areas of predilection in leprosy, and understanding the common sites of predilection can aid training healthcare workers and volunteers for more effective active case detection. Before concluding, I would like to acknowledge the contribution of Mrs. Avanti Patiraja, Mr. Enuku Bandara and Dr. Hasid Dilshan. Thank you for your attention.
Thank you, Dr. Viduranga, for that insightful presentation. The floor is now open for questions.
Thank you. It was an interesting paper. The issue is, first, there are two questions. One question is, now you said that the children most commonly affected size, upper limb 47.6, base 28.1, and lower limbs 26.3. So that adds up to more than 100. How do you explain that?
There are children with 2 or more than 2 skin lesions. So then some patients had involved both upper limbs as well as lower limbs.
So when you are saying most commonly affected, then you take more than one site also.
What we calculated was the children with at least one upper limb is involved, so we consider as upper limb involvement. The children with at least one lower limb is involved, we consider involved as lower limb when calculating the percentages.
Okay, I think there's a confusion with the term you have used, the most commonly affected site. Now leave aside. Now, have you looked into how these differ between gender or sex, males and females, and also different types of disease?
No, sir. In this presentation, we have not compared females and males with comparison to the distribution of body lesions or age. We have compared only the age group less than 15 years and more than 15 years only.
Maybe looking into that shows a difference in the previous studies also, so maybe it is an interesting area for you to follow up and see.
Actually, there's only one study which was conducted in Myanmar in 1995. They have shown that the uncovered body areas are more affected than the covered body areas. That was the available study, but there's no exact comparison between children and between the male and female or in age group.
That is not a scientific statement because the covered and uncovered differ between ethnic groups. Thank you.
Okay, thank you, sir.